Good evening, everyone. I am Dr. Fazil Ahmad, a liver and GI surgeon at South Asian Liver Institute in Hyderabad. We routinely deal with patients who suffer liver disease and wish to share some of our experiences. I have seen so many patients who would not have required extensive surgery or treatment had they been given the right advice at the right time. So we felt we must work to correct this state of affairs. Hence, on this day, the 28th of July, marked as Hepatitis Day around the world to bring awareness amongst the people about this condition which has grave consequences and such a mammoth scale of prevalence, we have Professor Dr. Tom Cherian, a pioneer in the complex field of liver transplantation and a visionary who would like to transform liver care in the country with South Asian Liver Institute. He has performed over 600 transplants in his career, including approximately 400 in London before his return to India. He has taught liver medicine for 15 years and has started at least 4 to 5 separate transplant programs across the country. He has over 100 scientific publications to his credit. Welcome, Prof. Over to you.
Thank you. Thanks, Dr. Fazil. So, today is World Hepatitis Day. And you can't really say Happy Hepatitis Day, can you? But I feel that it is an important marking on the calendar to let us know that we need to be aware of this disease. It is possible that you are standing next to somebody with hepatitis B and you don't know. It is even more possible that he himself does not know that he has got hepatitis B. So I thought we will cover some facts about hepatitis in general, viral hepatitis. Initially, we thought we will do the ABCs of hepatitis, but then I realized that most people seem to know the basics already. So I thought, let's make it interesting. Let's try and find some things that most people will not know. So I thought we will talk about 6 unusual things with hepatitis. So now, let's start with why should we talk about hepatitis? The Civil War. Well, you would all remember, the older ones of you will remember that there was a war called Bangladesh War, where the whole world was talking about it. There was even concert in London for the victims of this war, and approximately 300,000 people died. The world was shocked. And yet, nobody is shocked anymore in 2020 India, with 300,000 people dying every year of liver disease alone. We are having a war every year. Yet, are we talking about it? Not really. So that brings me to why we need this session on awareness for liver disease, especially viral hepatitis. So let's get into the facts. Fact 1, did you know that many scientists do not consider viruses a living thing? Yeah, they don't breathe, they don't feed, they don't grow, they cannot even move. They're only carried in your breath. In fact, why do at least some people believe that they're living? Maybe because they're able to replicate. I don't use the word reproduce because they're actually replicating. They, in fact, can't do it themselves either. When they get into other living cells, they gets into the DNA or the RNA of that living cell in its nucleus and induces that cell to replicate and create more proteins of the protein of the viral DNA. Quite complex. This, I guess, is one reason why you would want to call it living. But like I said, living or non-living, once it enters the cell, in this process, what it does is it kills off the host cell, which is what causes the liver failure, or in example of COVID, lung failure, because the lung cells are being destroyed. Fact number 2, it's a top killer. So we all talked about COVID and have been talking about COVID for the last 2 years, right? How many people has COVID killed? Maybe 4 million in the last 18 months. That's a lot. And that's in a very short period of time. So that's quite scary. And it scared us. It scared the medical fraternity too. However, if you look at hepatitis as a whole, it kills about 1.4 million people every year for the last 30 years. So cumulatively, it's killed about 42 million, 10 times as much as COVID has till date. And currently on this planet, there are 400 million people living with chronic hepatitis. So you could call it, a classic biological Hollywood thriller. The difference between corona and hepatitis, especially B and C, is that the disease transmission can be through just hand-to-hand contact, through food, through contaminated water in hepatitis A, E, and corona, whereas in hepatitis B and C, you need exchange of body fluids, like a blood transfusion. Fact number 3, hepatitis and cancer is linked. You see, what happens is, when you have viral hepatitis, it causes a constant and chronic inflammation of the hepatocytes. And what happens with this is, it goes into a state of constant flux. And this inflammation, cell death, new cells, inflammation, cell death, new cells, this cycle is set off, so much so that it is unable to stop. And the stop mutation is no longer possible. And therefore, this is what slowly turns normal liver cells into liver cancer. And the difference between what is a cancer and what is a cell is that it doesn't know when to stop. Whereas normal cells will stop, cancer cells do not stop. And in fact, according to the WHO data, chronic hepatitis B and C accounted for over 75% of cases in the world, of liver cancer cases in the world. That's an astonishing number. You would think that liver cancer is due to alcohol. There's a lot of talk about it may be due to aflatoxin, but 75% of liver cancer, so-called hepatocellular carcinomas, are due to hepatitis B and C. And in fact, this is a good time to point out that it doesn't need to be viral hepatitis. It could be fatty liver disease causing fibrosis and then cirrhosis. And cirrhosis itself is a pro-cancer. In other words, cirrhosis itself can develop or help you develop liver cancer. Fact number 4. What do you think is the commonest transmission with hepatitis B? Hepatitis B is 3 or maybe 4 times more prevalent than hepatitis C. And therefore, there's about 250 to 300 million people with hepatitis B or chronic hepatitis B in the world today. And what do you feel is the commonest means of transmission? Most people will say blood transfusion or operation. But the truth is, it is actually during childbirth. Yes, childbirth, from mother to child. The truth is, if there is a pregnant lady who is hepatitis B positive, it is possible that during childbirth, during the process of childbirth, she transmits this virus to the child or to the baby, and then the baby develops chronic hepatitis B. So it is absolutely essential that all pregnant women get tested for hepatitis B, and if it is positive, then we look at the count of hepatitis. That gives us the risk of transmission to the child. If she is positive, then vaccination immediately at birth and maybe some preformed antibiotics to the child will decrease the chances of the child developing chronic hepatitis B. Fact 5, this huge millions affected, millions killed is due to something very tiny. Did you know that these viruses are not even visible on even with a microscope, not even with a simple microscope? Until the advent of the electron microscope, it wasn't even visible. We need the electron microscope to show us a viron with those proteins inside and a cell wall outside. It is much smaller than a bacteria, for example, which are visible under the microscope. I found that fact pretty funny because it has brought the world to its knees, and yet it is not even seen on a simple microscope. Fact 6, ever heard of hepatitis B? It does exist. It is rare. And what is unusual about hepatitis B is that it cannot survive on its own. It needs hepatitis B to survive because of its mechanism of replication and survival. And therefore, if you are able to remove the scourge of hepatitis B, then hepatitis B dies with it. And therefore, it is the easiest way to protect yourself is to get the hepatitis B vaccine. In fact, that's a very important point. A vaccine for hepatitis B has been around for the last 20 years. It's being used. It is safe. It should be given to everyone who hasn't been exposed to the virus already. And it is effective in 95% of cases. So, ladies and gentlemen, mine is not a desire to frighten you, but it's a message of hope. What has happened recently in the world of medicine is that there are so many beautiful new, what we call direct acting antivirals, DAAs, that has made the treatment of hepatitis, especially C, simple, effective, and safe. And like I said, as far as hepatitis B is concerned, there has been an effective vaccine for the last 20 years, and I feel we must all use it. As far as hepatitis A and E is concerned, they are spread by contaminated foods, contaminated water, and therefore, if we stick to clean water, if we stick to clean food that is boiled and kept, then we hopefully should not get hepatitis A or E. What we talked about briefly is liver cancer, so-called hepatocellular carcinoma. The word cancer is actually quite scary, but I wish to bring a small ray of hope even in that arena by saying that if cancers are detected early, and the best way to detect these cancers is just restart it. Don't touch anything there, just restart it. Tell me when to restart it. Are there any questions? No questions. Then you make up some questions now. No, huh? Not recording. So, with liver cancers, um, you shouldn't lose too much hope, because if it is detected early, we can, with advanced surgery and chemotherapy, even these can be cured. So, I think um, my message is that please be aware of this disease. Please get yourself vaccinated, and hopefully uh, you will never experience the serious complications of this disease. So I think this is also meant to be a question and answer session. And the question is, one of the questions that we have had from our listeners is that can hepatitis be treated? So, like I said, different hepatitis need different treatments. So first, for hepatitis A, it's a self-limiting disease. It might cause a little bit of jaundice for a couple of weeks, but it shouldn't cause anything more serious than that, and hopefully it'll go away. The second point is if it is hepatitis B, for example. There are very good medications for hepatitis B. However, it is not possible to completely cure it, and therefore we might need to have these medications lifelong. But good, effective viral control, that means the replication of the viruses, can be stopped by these treatments. So the next question is, when do you need a transplant if you got hepatitis? A very good question. So I think the commonest time that you need a transplant is when the viral hepatitis has caused cirrhosis. And cirrhosis has gone on to what is known as end-stage liver disease. With end-stage liver disease, that means the liver is down to about 20% or 30% of its function. And only then do you start to experience what is known as life-threatening complications of end-stage liver disease. And when that happens, it is safer to have the transplant than to continue to try and treat it with medication. So the other question is, can you treat liver cancers if it has spread? Well, that's a good question. If it is something like a cholangiocarcinoma, which originated in the liver and it has spread to the lungs or somewhere else, then sometimes it is not possible to cure them, because we can't resect all the organs in the body. But if it has spread to nearby lymph nodes, close by, then we are able to take out the lymph nodes at the same time, and hopefully then the cancer doesn't come back. Another question I have been asked is, what is South Asian Liver Institute? Well, that's a straightforward question to answer. I've always, well, for the last 20 years been dealing with liver disease, initially for about 15, 16 years in London. And so, why do we, so in London, unfortunately, fortunately, the service is great. The National Health Service is there. It supports everything, and treatment is free to the patients. But here in India, we have a bigger challenge. We have a lack of awareness about the disease, which is the biggest problem. Because I think otherwise, it is not. People will come to us, then we can treat. Here we are finding out that people are suffering quietly at home, not knowing about what exactly is going on. So there are did you know that out of the 30 or 29 states in our country, we do not have transplantation facilities in 20 of them. So we hardly have transplant facilities in about 7 states. And this is yet another example of the lack of excellent liver services across our country. And therefore, I created something called South Asian Liver Institute, which is a small, dedicated liver center. It is not meant to help all the people in the world. It is not a multi-speciality hospital, but it is a single specialty hospital. So that allows us to concentrate our efforts on liver disease, its treatment, and one of the biggest things that we would like to do in South Asian Liver Institute is prevent liver disease. And therefore, such talks, I feel, if you think about it, if there is one listener today who did not know he had hepatitis B, after listening to this talk, was tested for hepatitis B, and then found to be having hepatitis B, and we were able to control the disease before he developed cirrhosis, then we have prevented the need for one patient to have a liver transplant. It is these kind of stories that we would like to create. It is this kind of magic that I would like to bring about with South Asian Liver Institute. So South Asian Liver Institute is a small group of liver specialists. We are liver surgeons, hepatologists, gastroenterologists, experts in the field of critical care for liver disease patients. So I feel that together, we even have, for example, nutrition therapists. We have physiotherapists who I think together with us will be able to bring patients back from end-stage liver disease sometimes, but hopefully if they are earlier than end-stage liver disease, early, just before cirrhosis. Unfortunately, by definition, cirrhosis means it is irreversible, but hopefully they are at a stage of fibrosis when, with the right treatment and the right advice, people can come back to having a normal liver. So these are the things that we hope to achieve with South Asian Liver Institute. We are centered in Hyderabad, but we do have satellite centers in other parts of the country like Calcutta and Guntur and Nagpur and hopefully soon in Bhubaneswar and Vizag, where we can try and bring this expertise locally so that patients are not having to travel thousands of miles. If you look at my last week's outpatients, we had about 50% of our patients were from outside our state. That means they have traveled more than 1,000 kilometers to reach us. And this I find a little sad because traveling with a patient is never easy, and I feel that we would like to keep this to a minimum. Another question that many people ask is, do you do transplants in all these places? We don't do transplants in all these places. Because transplantation is a very complex procedure. we would like to keep the safety levels very high, and therefore here everything is perfectly arranged for us to have the best possible outcomes. Starting from our ICUs, we have dedicated nurses, we have one-to-one nursing, sometimes two nurses to one patient, and all these are difficult to replicate in new centers for the time being. So we do hope to, we will try to achieve these centers in the future in all of these places, but not right now. Another feature that we have is online consultation, and this makes it easy for patients from, for example, Calcutta tomorrow to give me or give South Asian a call and say that I have this problem. What do you think is the answer? And it's very simple. It doesn't waste too much time, doesn't take too much money, and you will get an expert opinion. If it is a medical problem, our gastroenterologist will help. If it is a surgical problem, our surgeons will help. And of course, our anesthetists and critical care people that bring the whole thing together. We have something known as South Asian Liver Institute care program. So whoever has got liver disease who comes to see us, we try to bring them into our database so that we don't lose touch with them. And so every 3 months we see them again, we check whether we need to do anything for them, whether we need to prevent a complication from happening. For example, we would put them on a regular endoscopic surveillance program. This would do banding at regular intervals, which is to cut off the blood supply to these huge blood vessels inside the stomach so that these patients do not suddenly have an emergency life-threatening bleed. And these are the advantages of being on a program where there is a group of doctors closely observing you over a period of time. So I think we have covered a lot of ground, and I feel that I hope at least that we have given you some useful information that you can take away. Thank you all for listening, and let's stamp out hepatitis worldwide by 2030, which is one of the aims of the WHO, I think, a couple of years ago. Thank you, and bye.